Hello and welcome. I'm Sam Califer, your host for Vision, the show where we talk all about the College of Arts and Sciences, as well as its faculty and students. Today, I'm joined by Dr. Holli Seitz, an assistant professor in the Department of Communication. Her research focuses on health and science communication, as well as message and media effects. Thanks so much for being here.
Thanks so much for having me, Sam. Great to join you today.
Yes, I'm glad to have you on. Excited to talk about all of your work. But first, I was hoping you could introduce yourself, talk about your professional background, and how you came to Mississippi State.
Well, Sam, my professional experience actually began here at Mississippi State University. I got my bachelor's degree in communication here at MSU. And during the time that I was an undergraduate, I had the great fortune to become an undergraduate research assistant at the Social Science Research Center. While I was doing that work, I became really interested in public health because a lot of the social science research we were doing focused on health disparities in Mississippi. And one of my mentors said, "Have you ever considered getting a master's in public health?" I hadn't at the time. I didn't know anything about the field. I'd never considered that. But based on their recommendation, I looked into it and I ended up going to the University of Alabama at Birmingham to get a master's in public health, and I focused in health behavior. From there, I went to the Centers for Disease Control and Prevention in Atlanta, and I worked there for about 3 years doing health communication work. And during that time, I found that I was really interested in doing more research and learning how to do research on how health messages have their effects on their audiences, thinking about what can we do to make these health messages that we're putting into social media more effective at changing health behavior. And so I started looking at doctoral programs and decided to go to the University of Pennsylvania to get my PhD in communication because they have one of the best health communication programs around. So I was very lucky to go there. I spent about 5 years there. And then the best thing ever happened to me in that I got my dream come true to come back to Mississippi State University as an assistant professor in my home department of communication. And I also get to run a research laboratory at the Social Science Research Center where it all started. So I feel like I've come full circle, and I'm so excited to be back here doing this work.
That's great. So exciting to hear, how your career and your time at Mississippi State, led you all the way back here. And speaking about your expertise in health and science communication, that's really what I want to talk about today because they both seem so relevant to everything going on right now. So, what exactly are these topics and what kind of research do you do?
Absolutely, they are so relevant today. Health and science communication are both considered to be types of applied communication research because we're really taking what we know about communication theory and we are applying it in the context areas of health or science. Health communication encompasses a wide range of topics, everything from how patients and providers interact to mass media campaigns designed to change health behaviors. With science communication, the goals can range from getting people excited about science to actually trying to shape policy so that it's based on scientific findings. So, again, very wide ranging. Within these two areas, my work is primarily what we would call message effects research. And that means that I'm really trying to figure out how messages have their effects on our particular audience and how we can change features of the message so that it has a greater impact on outcomes like health behavior, which is one of my big focus areas.
That's great. Yes, I think so interesting to hear how you apply the communication theory to areas that people might not typically think about. So that's great. And I now I want to focus on the health communication specifically. I know at least two of your projects have had a lot of success. One, you work with the Extension Services Promise Initiative, which is all about preventing opioid misuse in Mississippi and the entire Southeast. And then you also helped with MSU's COVID safety response, Cowbell Well, which has proven to be a great initiative, has really kept everyone safe this past year. So, what kind of role did you take on with those projects?
With the PROMISE initiative, which, as you said, stands for Preventing Opioid Misuse in the Southeast, I've been working with that project for several years. And my main role in that is as a health communications specialist to help design and test messages that go out within the state of Mississippi to help people prevent opioid misuse. Currently, the big focus of the PROMISE initiative and their media campaign is on helping people learn how to safely and securely store medications in their home so that we prevent misuse. And that includes storing medications up, out of sight, and in a locked cabinet if possible. And also helping people learn how to dispose of medications that they no longer need so that those medications, and particularly opioids, are not stored in their home and can't be taken by someone accidentally or stolen. And so the best way to dispose of medications you no longer need is to take them to a medication drop box. These drop boxes might be located in pharmacies throughout the state. They're also sometimes located in law enforcement agencies. And so our goal with that campaign is to help people learn about those behaviors. And my role is really making sure those messages are as effective as possible. One of the ways that we do that is by having interviews with members of our priority population. So we will sit down with people around the state of Mississippi, show them a sample message, and get their feedback on that message. Is the language that we use something that they identify with? Is it clear to them? What we learned in some of our research is that people don't really use the word opioid when they're talking about opioid medications. A lot of times they refer to these maybe as prescription painkillers or pain medicine. And everybody who's not working with this project may not know exactly which medication falls into that class of opioids. And so we work to make sure that our language is clear, that our imagery is clear, and that those messages are the very best that they can be. You also mentioned Cowbell Well, which is our university initiative to help keep our university community safe during the COVID-19 pandemic. And what a challenge this has been for the university and our country and the world. Our work with this started with sitting down with students and their parents to talk about some of the health behaviors that have been recommended by public health agencies as a way of helping to prevent spread and infection. And so things like wearing face coverings, maintaining 6 feet of physical distance, and good hand hygiene behavior. And we sat down and we used what we know about behavioral research and communication research to try to understand factors that might facilitate their doing these prevention behaviors or things that might serve as barriers to them doing these behaviors, things that might keep them from doing what we know will help prevent the spread. Once vaccinations became available, we've tried to expand our work to include that. When we first started our work, vaccinations weren't even an option yet, so we focused on some of those other prevention behaviors. And then we've taken what we learned from those interviews and some surveys that we did and used them to inform the campus's response. So things like signage, naming, making recommendations on behaviors. And it really just helped us understand our audience, which is what communication research is all about. We want to use those communication research skills we have to understand audiences and make it more likely that our message will have an impact.
That's great. And it's so fascinating to hear how, your knowledge of communication and how to get your point across can really impact some of the biggest issues, going on today. So that's so great. And then kind of changing gears, you also are an expert in science communication. And so I know recently you helped co-author a presentation that was all about how to speak to climate change deniers about their beliefs. So what were some highlights of that talk?
Well, that work was led by one of my former students, Alicia Brown, and this formed part of her senior honors thesis. So, as a professor, it was such an honor for me to be involved in that work and to help inform her research. One of the big takeaways that we learned from that work is that when we're talking about science topics, We need to get to know our audience. And so in this case, she was thinking specifically about people who don't currently believe that humans play a role in climate change. That was the group that she was most interested in. And she wanted to learn how to convey climate science information to that particular audience. And one of the things that she investigated was the role that different spokespeople might play in shaping audience perceptions to a message. And for me, one of the big takeaways from that particular work was that non academics, such as high school science teachers, people who are not at a university, really resonated very positively with that audience. And they prefer to hear science messages from a member of their community, like a high school science teacher, over someone at a university who we might typically look to as experts on a particular topic. And so I think that that takeaway from that work is, again, to learn about your audience, investigate different aspects of a message that may change the impact. In this case, the source of the message.
That's great. And this will be my last question. I think it's a good one to end on. Just in a general sense, what kind of insights do you hope your field can have in our age of misinformation and distrust?
Well, I have done some research on misinformation, Sam, and I have two really big takeaways from that field of work. Not only my work, but the work of many other scientists who are working on how to correct misinformation and prevent it from having its effects. One of the big things to keep in mind is sort of the downside, and then I'll present the silver lining. If someone hears misinformation, my research and research of others has shown that we may never be able to fully correct that misinformation. Once you've heard something, it can't necessarily be unheard, and that's the downside. The plus side is that corrections from many sources, including non-experts, can make a difference in somewhat correcting that misinformation. So we should still try. And as we are trying to correct any incorrect misinformation that's out there in the information environment, the big thing that I want everyone to remember is that the biggest recommendation is to never repeat the misinformation when you're offering the correction. What you want to do instead is to emphasize what is correct and what is known to be the scientific consensus at that moment. So you want to emphasize that and not repeat the misinformation, because when we do, if we repeat misinformation, that reinforces it. Every time we hear something, we start to believe more and more that it's true, and we don't want our misinformation correction to have a harmful effect on our audience.
That's great. Thank you so much for all of your um, research and that practical advice. And thank you for joining us and speaking with us today. And thank you all for tuning in to this episode of Vision. We'll see you next time.